Okay, thank you very much, Paolo. And again, good afternoon to all of you. And my apologies for keeping you waiting since 10 a.m. We wanted to do this much earlier, but we wanted to make sure that what we are reporting to you today is indeed as accurate as possible. Okay? And again, joining me in today's press con is Dr. Rabi of the WHO country office. Okay, WHO representative country office, and of course we have ASEC Virgeri and director of RITM, Dr. Celia Carlos. The DOH confirms that the previously reported fifth case of corona disease 2019 or COVID-19 as the first case of local transmission in the country. After verification with the Bureau of Immigration showed that the patient had no recent travel history. DOH also reported, or rather DOH also reports that the patient's wife tested positive for COVID-19 after contact tracing activities were prompted. This brings the total number of COVID-19 cases in the country to 6. The sixth confirmed case is a 59-year-old female who presented with cough and was admitted at the Research Institute of Tropical Medicine, or RITM, on March 5. The patient is currently in stable condition. The DOH is currently exhausting all its efforts to identify others who may have come in contact with the confirmed cases to ensure that this localized transmission does not progress to community spread. In light of the confirmation of localized transmission in the country, and in anticipation of possible sustained community transmission, DOH has raised the COVID-19 alert system to code red sub-level 1. I repeat, code red sub-level 1. I must clarify that this is a preemptive call to ensure that national and local governments and public and private healthcare providers can prepare for possible increase in suspected and confirmed cases. With this code red, the DOH has recommended to the Office of the President for the declaration of a state of public health emergency, which will facilitate, let me repeat, which will facilitate mobilization of resources, ease processes, including procurement of critical logistics and supplies, and intensifying reporting and quarantine measures. At this stage of localized transmission, intensified contact tracing, and home quarantine of close contacts of confirmed cases, improved hospital preparedness, enhanced severe acute respiratory illness surveillance, and activation of other laboratories outside of RITM to increase capacity to diagnose are now being implemented. This declaration is a signal to all concerned agencies, local government units, and healthcare providers to be ready to implement planned response measures. We are continuously reminding everyone to practice personal protective measures such as hand hygiene, social distancing, and proper cough etiquette. Avoid unnecessary travel and postpone mass gatherings as well. It is our individual responsibility to protect ourselves and the people around us. Only through collective action in our communities will we be able to limit the spread of the virus. However, once there is sustained community transmission or an increasing number of local cases whose links cannot be established, the strategy will be shifted from an intensive contact tracing to the implementation of community-level quarantine or lockdown and or possibly suspension of work or school. This will be implemented in municipal, city, or provincial scale as may be warranted. Augmentation of health staff from unaffected areas and uniformed personnel will also be facilitated. Now, in terms of our appeal to the responsible sharing of information, insofar as responsible sharing of information is concerned, we would like to remind all healthcare providers, institutions, and stakeholders to exercise utmost prudence in sharing sensitive information about suspected or confirmed cases. Our objectives for sharing information are two-pronged. Ensure the public's health and safety by facilitating contact tracing, and ensure that the individual's right to privacy is not impinged. Hence, we appeal to all to coordinate closely with the Department of Health when disseminating information to the public and within their respective institutions. Let us make sure the information sharing process will yield the utmost benefit and avoid unnecessary stress and stigma to individuals. The DOH commits to be more circumspect in reporting confirmed cases, to balance interests of public health and privacy. To this end, only pertinent information necessary to facilitate contact tracing will be provided to the public, such as activity, location, and time if available. For improving diagnostic capacity, the current gold standard for diagnosing COVID-19 is through laboratory-based polymerase chain reaction, or PCR testing. RITM, with the assistance of the WHO, is currently capacitating 5 sub-national laboratories for PCR testing: San Lazaro Hospital and Lung Center of the Philippines in Manila, Baguio General Hospital and Medical Center in Northern Luzon, Vicente Soto Memorial Medical Center in the Visayas region, and Southern Philippines Medical Center in Mindanao. In addition, efforts are underway for the University of the Philippines National Institutes of Health to be similarly capacitated. DOH has received several proposals of rapid testing kits, including one that has been developed locally. To date, these kits have yet to be listed or validated under the WHO Emergency Use List. Such validation is indeed necessary to ensure accuracy of test results. We don't like false negative results, okay? You say patient is negative and in fact it's positive, you let them go, that's really scary, okay? DOH is determined to expand our testing capacity for COVID-19 to immediately ascertain that cases are identified and dealt with. We are studying these proposals to ensure that they are accurate and safe for public's use. Enhanced testing capacity is a prerequisite to prevention and containment. Hence, the DOH is placing expansion of testing centers as one of its topmost priorities. Lastly, updates on contact tracing. On the new 3 confirmed cases, the Epidemiology Bureau, or EB, in coordination with Centers for Health Development and city health offices, is currently establishing travel history and identification of individuals who might have had contact with the positive cases. Identified contacts are being interviewed and assessed for signs of respiratory illness. We will be prioritizing testing of these symptomatic individuals found to have had close contact with the confirmed cases. We urge those who may have interacted with the confirmed cases within the past 14 days to immediately call the DOH hotline at 02-8651-7800, local 1149 and 1150 for appropriate referral to a health facility. DOH reiterates that based on current data, this is very important. I have said this before, I'll say it over and over again. 81% of cases have mild disease. About 14% appear to progress to severe disease, and 5% are critical. For persons with known history of exposure or travel and with mild symptoms including cough, fever, cold, and sore throat, DOH is advising you to undergo home quarantine and contact your respective city, municipal health office for proper assessment, monitoring, and management. Let me reiterate, we have recommended the declaration of a state of public health emergency despite the fact that we only have 2 cases constituting localized transmission. Trust that the Department of Health is proceeding with utmost vigilance and is working vigorously to protect Filipinos against COVID-19. End of my press statement.
Thank you so much, Secretary Duque. We are now opening the floor for questions. Just a gentle reminder to please raise your hand and wait to be recognized before proceeding to ask your question, and to also try to limit your question to 1 at a time. The lady in red first, and then the lady in white.
Hi, Secretary Max po from the 25. Sir, may we know po, kamusta na yung other members po ng family nung mag-asawa na nag-positive sa COVID?
I am informed that they are asymptomatic. Wala po silang sintomas. Okay, yun lang.
Sir, pardon po, no? Pero meron po kasi mga lumalabas sa social media. There's someone saying from Cainta, and then there's one po yung isa raw na opisina sa May Taguig. Are these also part of those na nag-positive? Or what's your message?
You're talking about the Deloitte.
Yes, yes.
Okay,
Opo.
that's the one. That's the first local case. No, not really a local case, but one of the cases we reported yesterday.
Okay, so kasama na po
Kasama
siya dun sa
yan.
6.
Kasama
Opo.
yan.
Yun naman daw po doon
Sandali
sa...
lang, no? Gusto ko lang din ipaalam sa inyo. Halimbawa, ang Cardinal Santos. Tumawag yan kay Dr. Mapue ng Center for Health Development. They made a request na kung pwedeng wag babanggitin yung Cardinal Santos Medical Center. Only to find out later, sila pala mismo ang nagbanggit ng sarili nila. So, this is not fair. They're going to request that their institutional names not be mentioned, only to find out that they are on their own mentioning. So kung ganun pala, let's just say, all these institutions, because it's not fair, di ba? Makikiusap kayo, tapos sabihin namin, okay, we respect, okay, tapos maglalabas kayo, hindi naman tama yun. So I am telling you, this is really, very unprofessional on the part of some of these institutions.
Sir, yung sa Deloitte po, dapat po nag-inform muna sila sa DOH. Is that the proper way to go about it?
Ang sinasabi nga namin, ma'am, meron namang karapatan ang mga private institutions para magkaroon sila nung pag-i-inform sa mga tao na meron silang ganon. But ang sinasabi lang ho namin, sana po nagkakaroon tayo ng ugnayan kapag dating dito sa pag-share ng information. Dahil alam po namin ang intensyon ay maayos dahil gusto lang nilang pangalagaan ng kanilang mga empleyado. Ngunit pag tinignan ho natin sa isang banda, yung implikasyon naman ho sa buong populasyon na nagkakaroon ng takot, nagkakaroon po ng stigma yung mga tao na nagtatrabaho doon. So ito ho sana ay maiiwasan natin kung merong direct na pakikipag-ugnayan.
Sec, yung last na lang po, yung tungkol po doon sa lumalabas sa social media, tungkol po doon sa homeowners ng Cainta. Is that related to one of the 6 cases na po ba?
Oh, yes, they are residents of the 5th case. So, tama.
Sir, before this press con, marami kami nakitang pulis sa labas. Does it be, ang balita, sir, nakuha namin, andi dito na NCRPO chief. May panic na ba talaga sa Metro Manila about yung...
Nag-meeting lang sila, nagpa-orient. on the guidelines as to what to do, the PNP, how they can help, ano yung preparations, so yun lang. Wala naman, kasi ano naman gagwardyan dito? Baka ikaw.
Tanong lang, sir. Napansin lang, sir.
Jovic, and then Sir Rafi.
Sir, in terms of the testing kits lang na meron tayo ngayon, is it adequate? And how many more testing kits are we expecting from WHO to come habang wala pang verification for the testing kits that are being developed here locally?
Can I just ask WHO country rep to answer that?
WHO is responding to requests from the Department of Health and particularly from the RITM. We need to recognize that there is a huge global demand for these reagents, chemicals, and testing materials. So we are also having challenges of rapidly procuring the numbers. But so far, we are delivering. Just last week, we delivered, earlier this week, we delivered 5,000 test kits. We have in the pipeline other test kits arriving middle of next week. We are processing fresh requests for increased quantities based on what the evolving situation on the ground now. And we will do our best to ensure that the DOH and RITM don't run short of their requirements.
Yes, Sanya, RITM Director Carlos.
May I add that parallel with the kits being provided by WHO, we have several weeks ago initiated local procurement of the same kits from foreign suppliers. But the limiting step, as was mentioned, is the availability of such reagents and kits internationally because of the huge demand. So we have worked in multiple ways so that we will get the necessary reagents and kits to be able to do the laboratory testing.
And if I may add, I would take this opportunity also to acknowledge that WHO is being supported by USAID, who has provided additional funding so that we can expand and procure larger quantities of testing materials. So I take this opportunity to thank USAID also on that.
Well, same is true for the DOH. We thank all the development partners for their staunch and material support to the cause of effectively responding to the manifold challenge of COVID-19.
Sir, by raising the alert level to a code red, so if a patient suffers from fever, sore throat, cough, ito yung the usual symptoms that we have for COVID-19, will they immediately be tested for COVID-19, or what's going to be the process?
Unang-una po, meron ho tayong fina-follow na decision tool, no, kapag tayo ay nagka-classify ng isang pasyente. Ang decision po para mag-shift tayo to this code, another level of alert level, is for us to preempt, no, the possibility at maghanda po tayo, no, ma-facilitate natin ang mobilization ng ating mga resources, makapag-preposition po tayo ng critical logistics. As to kung paano natin masasabi, hindi ho natin sinasabi na porke nag-raise tayo ng alert level, lahat na lang na makakaramdam ng may sipon, may ubo, maglagnat ay kailangan pumunta sa ospital. Ang sinasabi ho natin dito, yun pa rin hong ating decision tool, yun hong ating criteria kung kailan ho kayo pupunta sa ating mga facilities ay masusunod pa rin. So kung kayo ay may history of travel, kung kayo po ay may mga simptomas, at kayo po sakali, no, ay kasama dun sa may exposure at you had direct contact with these people who are positive right now, and then you go to the facility. But for all those persons na nakakaramdam ho ngayon ng mga simptomas, na nakakaramdam ng lagnat, ubo, sipon, wala naman hong history of travel, alam naman po nila na hindi po sila nagkaroon ng kahit na anong way na makasalamuha yung positibo nating kaso sa ngayon, hindi po kailangan pumunta sa facility. Sec, let me just take this opportunity to just masabi lang, may kumakalat ho ngayon sa ating social media na nakalagay, ina-advertise ho yung ating serbisyo sa RITM. Sinasabi po doon, ang RITM 24/7 na bukas, free ang testing at kahit sinong makakaranas ng ubo at sipon o lagnat ay pumunta doon para matest. Hindi po ito totoo. Kailangan pa rin ho tayong magkaroon ng mga protocols kung paano natin ito gagawin. Katulad ng sabi ko, yun lang pong may history of travel or exposure. Doon po sa ating sinasabing mga positibong kaso ngayon or na-interact kayo with them, nakasalamuha, yun lang po with symptoms ang pwedeng may test ngayon sa ating mga facilities.
Alam niyo, kanina sinabi natin binigyan diin yung global supply is not adequate. No? So, it doesn't make sense for this social media to allege that RITM is open to receive anyone for testing. So, it doesn't make sense. No? So, gusto lang natin linawin.
Next question,
If
Sir
I
Rafi.
follow, if I may add, please, what we have now is localized transmission. And what the DOH is trying to do is to define the parameters by case, by contacting the close contacts, testing them, doing the case investigations to define what are the parameters of this cluster. So we need to be conscious that anybody in Manila or in the Philippines who has a respiratory tract infection is not having COVID-19, right? WHO has, right from the beginning of this outbreak, saying we are in that season where you see a lot of flus, and we need to practice social distancing, frequent hand hygiene, and cough etiquette, so that we minimize the spread of flus. And that situation still applies to the Philippines. We want to clearly define who is affected. Is there transmission beyond these 2 cases that we have confirmed, right? And we need to identify who could be at risk. So the mere fact that you have a respiratory tract infection doesn't mean that you need to be tested for COVID, right? Unless you have been a close contact with these cases. As we investigate these cases, we'll have a clearer understanding of the local spread of this disease. And that information, when available, will be shared by DOH with you and the public. So we urge you to still be rational and not demand that every single respiratory tract infection that anybody contracts needs to be checked for COVID-19. That is not a possibility for any country. Right? Every country practices contact tracing, and if you have suspected exposure or travel history, only those people are tested. You cannot test everybody. So we have to be realistic about capacities.
Last na lang on my answer. Yung case number 5 natin, sir, meron na ba tayong initial information kung sino or saan niya likely nakuha yung infection? And kapag na-declare na ho yung public health emergency, what would happen sa mga schools, sa offices natin? Ano yung mga actions na may kita natin? Kasi right now, Navotas has already suspended classes on Monday in light of the COVID cases.
Hindi siguro dapat ginawa muna yon. But that's their decision, being independent or being covered under the local government code. So that's their own decision, but as of today, we are on sub-level 1 of Code Red, and that is not being recommended. So hindi po tama na yun ay gagawin sa ngayon. There will be triggers that will make the DOH recommend part of the sub-level 2 under Code Red. So, meron na po tayong protocol patungkol dyan. So, ito naman patungkol dun sa ikalimang pasyente, there has been no report from our contact tracing teams or the team that's assigned to this case number 5 as to the possible source of the infection. That hasn't been established.
Secretary.
When do we expect the Malacanang to heed the recommendation of the DOH? Is this immediately?
I think that is we're looking at Monday for the declaration, for the release or issuance of a document that will say that the president has approved our recommendation.
Okay, so just to be clear, contact tracing is still ongoing, but as Asik Vergeri said, you will shift starting on Monday. O magpapatuloy pa rin ba yung contact tracing? Hindi na po.
Tuloy, patuloy yung ating contact tracing. Ito naman shift to sub-level 2 of Code Red kapag kami na-establish na tayong mga community transmissions or several unlinked, hindi linked na mga clusters of cases. So wala pa tayo sa ganun stage. So it is premature to even consider that at this point.
Secretary, last na lang po siguro. I just have to ask this, Secretary. There are some groups who are questioning the transparency of the DOH in terms of giving information to the public. There was also a senator who says that the DOH should not be giving the public a false sense of security. Can we just get your reaction on this?
You see, from as early as about 3 weeks ago, I kept saying that it is not a question of if, but a question of when. Hindi ko po sinabi na hindi tayo magkakaroon ng COVID-19 sa Pilipinas. You can look at all your documents, your tapes, capturing my PRs, and you will see very clearly. In my interviews with the radio and television, I always said, hindi kung ito ba darating. Malamang darating. Yun lamang kailan. So nakita na natin, dumating na. Noong March 5. That was yesterday. Friday ba yun? Yes, Friday. Okay? So I never said that, oh, we're okay. Nothing to worry about. Kayo, andito kayo, di ba? Alam naman ninyo yun, di ba? So I never said that, so I'm sorry. I totally disagree with that statement because it has no basis whatsoever. Okay? Ngayon, yung mga iba naman na mga nagkakalat ng kung ano-ano, yung transparency, gaya ng sinabi ko sa inyo, we were requested by a certain institution, by the hospital, okay? Not to disclose. So we saw the reason. Why not? Kasi baka yung mga empleyado nila ma-stigmatize, etc. But hindi naman tama yun. Sasabihan mo kami, tapos pala mamaya-maya, ikaw mismo ang magbubulat-lat na sa inyo pala galing yung pasyente. O, di umano. So, ilagay nyo naman dyan that hindi naman tama ito. Di ba?
GMA 7 din, Ma'am Sheila.
Yes, sir. Abida Towers and St. Luke's issued a statement. So can you confirm, sir, kung involved dito yung case number 5 that they handled case of COVID? 4.
Yes, for this, because they have already issued the statement, it came from them. Yes, one of the patients were involved and was part of this building and also coming from that hospital.
Case number 4.
Case number 4.
Sir, update po doon sa contact tracing for the 3 foreign nationals. Ilan na po ang na-contact?
Ongoing pa ho yung ating efforts doon, though kahapon po nasabi natin mag-head at mapuntahan po yung mga naitala natin ng mga impormasyon base dun sa 3 napuntahan ng ating 3 foreigners. So in the coming days, we will be providing you with updated information. Sa ngayon po, ongoing, lumabas pa lang ho yung mga tao natin para puntahan itong mga lugar na to.
Sir, update sa Grand Princess. May information na kayo kung ilan yung Pilipino, kung may positive ng Pilipino dun sa mga on board?
What we know as of this morning is that 46 people on Grand Princess were tested, 21 of them were positive. Among the 21 were 19 crew members and 2 passengers. Among the 19 crew members, I understand there are 6 Filipinos. This is unconfirmed reports. This is what we've just heard. So we understand that among the positives, 6 of them are Filipino crew members.
Sir, sorry po. Is there any specific orders from the President on the recent cases?
None as of the moment.
Sir, in green.
Secretary, mamaya uuwi na yung 137 na Filipinos. Home quarantine pa rin po ba sila, sir? From Macau.
Uwi na po yung ating mga repatriates, no, mga kababayan galing sa Macau, at ang kanilang classification po ay magiging persons under monitoring. So mag-home quarantine pa rin ho sila, bibigyan ng advice. Kung meron ho tayong makitang symptomatic sa pagdating nila sa pag-assess natin, yun po ay magiging patient under investigation.
The lady at the back, please.
Ano po yung condition po nung 3 patients na nasa RITM, yung 62-year-old po tsaka yung 48-year-old?
I would like to request Director Celia of RITM to respond to the query.
The 48-year-old and the newest case, our 6th case, are having just mild respiratory symptoms, whereas the 62-year-old is in a guarded condition because he still has severe pneumonia, plus other medical problems like diabetes, hypertension. And we recently identified another medical problem, which is acute kidney injury, which may be due to multiple factors present in the patient. So, on the other hand, his oxygen requirement is less, and his need for drugs to elevate his blood pressure is also less. So there are good developments, there are also bad developments. So in general, I would say he is in a guarded condition.
So, clarify ko lang po, hindi po critical condition, guarded lang po.
No, that's critical condition. Yeah. So let's be reminded that based on the experience, the clinical conditions of severe cases as reported in China, it takes very long time for them to recover, from 3 to 6 weeks, when critical. However, if mild, it's anywhere from 2 weeks to about 3 weeks.
Analu.
Well, they're undergoing assessment. They're, I believe, at different stages of compliance with the standards. And perhaps, again, Director Celia might be able to answer that more authoritatively.
The 5 subnational labs who are being provided capacity to test have completed their training on COVID identification yesterday, and in the proficiency test, all of them passed. I'm happy to report that all of them passed the proficiency test. In addition, there is another laboratory, the UP-NIH, whom we are providing technical assistance as well, and we will be evaluating their facilities next week.
All right, Ma'am Sheila, then GMA 7.
Ma'am, mga ilang days pa po kaya bago masabi na pwede na po silang mag-test po for COVID?
Actually, since they already showed capacity, if we only had the reagents, complete reagents, they could start any moment from now. But since we're still awaiting availability of reagents, it may take some time more for them to be able to test on their own. But we will look into our resources in RITM if we can, distribute the limited resources that we have to them. But considering that most of the testing needs are in NCR, we think that priority should be given to laboratories within NCR for now.
Currently, gaano karaming testing kits na available sa RITM?
So for now, there are actually different testing kits to do a complete test. Just to clarify that, marami pong iba-ibang klase to complete the whole testing procedure. But we have kits enough to complete about 2,500 tests at the moment.
GMA 7 and Sir Jovic.
Sir, nabanggit niyo po yung social distancing and iwasan muna yung mass gatherings. Ano po sa Holy Week, sir? Would you discourage yung mga bisita iglesia or mga activities to be set aside?
Hindi naman. Basta yung social distancing mo as much as you can, 1 meter away from each other. That's one. Then number two, just don't, as the church hierarchy has repeatedly reminded us, huwag nang hahalik dun sa mga imahe. Okay? So, meron ng mga precautionary measures ang simbahan Katolika. So, sundin natin.
Isa na lang po, yung pong binaplahan ng Japanese National, yung mga hotels, ano pong ginawa doon sa mga pinagdaan?
Kasama yan dun sa contact tracing na sinasagawa since yesterday. So we will just give you regular updates on the coverage, the performance of the teams responsible for contact tracing.
Disinfection po ng mga hotels.
Oh, that's a given.
Sec, yung sa case number 4 lang natin, can we identify the flight number nung patient? And given na dumating siya ng February 25 and nag-manifest yung symptoms niya ng March 3, pumasok pa ho ba siya sa BGC during that 1-week period?
Can I request ASEC Vergeri?
Yes, sir. Doon po sa tinatanong nyo no, na history niya, yung chronology, kung pumasok pa siya, apparently doon sa kanyang binigay na informasyon sa amin ay nakapasok siya no, ng isang araw kung saan siya ay nagkaroon ng meeting no, kasama yung mga kaopisina niya. So yun sa kanyang doon sa kanyang binigay na history sa amin. At kung ano yung kanyang flight number, sasabihin ko. Okay, it's PR421 coming from Japan, Haneda Airport.
Clarify lang, kaya po tayo nag-code because of the local transmission. Yung po ba yun? Yung nag-trigger for the code red sub-level?
It's one of the triggers, okay? So because we have two localized transmission or cases, no? So that is why we did not need to go to sub-level 2, sub-level 1 now. So it's calibrated.
Sir, confirm po, yung 3 new cases po, lahat po yun Filipinos po?
Yes.
Okay. And ilan po yung dapat na local transmissions para ma-declare na sub-level 2 po? Yung
There has to be unrelated or unlinkable cluster of cases. Okay, different places, simultaneous. There are transmissions going on.
Last 3 questions, Sir Ravi.
Secretary, can we get an update on the repatriation of the Filipinos stranded in Macau? We understand that they are arriving today. What will happen to them? What are the procedures?
Yes, sir. Sa ngayon po, no, ang ating mga repatriates or mga kababayan galing Macau, total of 162 of them ay uuwi dito sa atin sa Pilipinas. Nagkaroon na po tayo ng usapan no, with other member agencies of the Interagency Task Force kung saan nakapagbuo tayo ng protocol o procedures po mula po sa paglapag ng kanilang eroplano hanggang sa makababa sila, hanggang sa sila po ay magkaroon ng staging where we can do assessment sa kanilang lahat. So silang lahat po ay mag-undergo ng assessment, titignan kung sino sa kanila ang may mga simptomas. Kung sino po sa kanila ang may mga simptomas, may nakahanda po tayong mga ambulansya na mga doon po sa ating area at dadali na sila doon sa ating referral facilities. Yun naman pong walang simptomas ay i-advise po sila for home quarantine. Meron pa rin hong mga ibang proseso no, na ibibigay at gagawin kasama ang ating OWA at saka Department of Foreign Affairs and of course the Bureau of Immigration kasama sila. Pagkatapos po nun ay sila na po ay uuwi. Now when they get home, there is this monitoring scheme kung saan katulong naman po natin ang ating local government units and of course OWA para maipatupad natin at masiguro natin na talagang magka-quarantine po itong ating mga kababayan.
Last two questions.
Sir, yung dinisinfect kasi kahapon yung Muslim prayer hall dun sa San Juan. May we know kung paano ginagawa itong disinfection process and regular disinfectants lang ba to? And kailan pwede gamitin uli yung facility?
I am told it is 1:100 the hypochlorite solution which is used to spray the areas for disinfection, and it's very effective. It's the most effective, in fact. Huh? Ah, 24 hours. Yeah. So after that, that can already be reopened by 4 o'clock.
Good afternoon po. From UNTV po. What scenarios are we expecting po if public health emergency is declared?
Well, I have told you that once the state of public health emergency is declared, this will facilitate mobilization of resources, ease the processes, including procurement of logistics and of critical logistics and supplies. Mandatory reporting has to be done, mandatory quarantine. So, yun lang naman yun. There is a very clear set of objectives why that is going to be declared.
Thank you, sir.
We're accepting one last question. Anyone? If none, that ends our press briefing for today. Thank you so much to our panelists and to everyone who came on a Saturday. And we'll see you again next week.
Okay, thank you very much, Paulo. Thank you, Dr. Rabi, once again. Thank you. No shaking of hands? Yeah, just like that. Okay. Sanya, bye.